patients with additive homeopathy lived for 6 months longer than the other ones. I would say never give up. Even if you can't heal a patient, and those patients are in a very advanced stage of their disease, I still believe the improvement of quality of life is something which is very important.
Hello, good morning. This is Homeo Sapiens. My name is Barbara Liberowicz, and my guest today is Professor Michael Frass, already known to our listeners, very famous and respected person in the homeopathic world. Welcome, Professor Frass.
Hello, good to see you. Thank you for your invitation.
Last time we were talking about ICU, and I liked what you said. It is easy, it is safe, it is effective. So nice to hear these words about ICU care.
Yes, last time we were talking about ICU, but today we want to talk about the study we have performed at the Medical University of Vienna. Actually, it started 2010, and it was performed at the Division of Oncology at the Department of Internal Medicine 1. And this study was investigating whether additive homeopathy has any effect on life quality and also on survival of patients suffering from non-small cell lung cancer. And those patients were from groups 3B and 4, so in a very advanced stage of their disease. So we had altogether 3 groups. 2 groups were compared double-blind, placebo-controlled, randomized, and these 2 groups received either individualized homeopathy or placebo. Those 2 groups were investigated with regard to quality of life and survival. And in addition, so to avoid any potential influence from my personality, we had a group 3, and this group was only investigated regarding their survival. So they never met a homeopath.
What was the result of the study?
No, the result of the study was that patients with additive homeopathy had a significant higher level of quality of life.
Wow.
And surprisingly for us all, also the survival was much better. So the patients with additive homeopathy lived for 6 months longer than the other ones. And this was there was almost no difference between the placebo group and the control group. So we all were very excited about the results of this study.
As far as I can remember, there was 1 month difference in the life expectancy between placebo group or this group that didn't have any intervention at all. So, do you think it means even homeopathic case taking can be an intervention?
Yes, this might be the case, but this was only 1 month, so this was not significant. And I suppose just taking your time, taking this extended history in homeopathy might have a positive influence, of course. But it was not really something which was affecting the study in a great extent.
Let's forget statistics for a short moment. Also, statistic is very impressive, but what was your observation? What changed in these patients during the observation time?
I think the most important thing was that most patients reported that they have better tolerance to chemotherapy. And I think this is one of the major positive effects of homeopathy we have observed also in a previous study. So I believe that it is meaningful to use additive homeopathy in cancer patients undergoing chemotherapy and or radiotherapy.
What is puzzling me, this 6 months long difference Was it contributed to some cosmetic homeopathic care?
It is a very difficult question to answer. First, we believed that the quality of life might have been responsible for this prolongation of survival. However, a group which investigated our study very deeply, they also analyzed the influence of quality of life on survival, and they found that there's no correlation. So now I'm more than before convinced that homeopathy itself might have a positive effect on survival. In which way? I don't know. But there are some theoretical papers which showed that if you are investigating cancer cells, you might see an effect of homeopathy.
Because what I imagine, for instance, we have a patient who had undergone radiotherapy, and we give him, for instance, phosphorus, which is known to palliate the effects of radiotherapy. So if we give phosphorus, do we treat burns or do we treat phosphorus patients?
Yes, I think it's the question whether it's more a constitutional effect of homeopathy or whether it's a direct tumor effect. I believe that both is possible. It depends on the stage and on the actual situation of the patient. Sometimes I have the feeling that there's a serious psychological problem, which might be relieved by help of a constitutional remedy. And in other cases, I believe we have to look to a tumor-specific remedy or something which may be found by location. So I took a trick, or I used the trick when I knew the position of the lung cancer is on the right side, on the left side, or on the upper or on the lower part of the lungs. I used the rubrics which are describing the different remedies in lung inflammation, in pneumonia.
Okay.
And then you can also look to all these locations.
Okay, so coming back to the remedies, which is most interesting part of the study. What was the most common remedy you used in this observational study?
Not surprisingly, we used phosphorus very, very often.
Mhm.
I think it was the most used remedy. Actually, it's now called homeopathic medicinal product. And I believe I have also described that we have used the Q potencies, the liquid forms of homeopathy, and we have learned this from the Swiss clinic from Dario Spinelli.
What other remedies would be often indicated?
As far as I remember by heart, I think it was arsenicum album, calcium carbonicum, also sulfur, and we used in many cases, of course, to relieve the side effects of chemotherapy, Nux vomica, and for relief of radiation therapy, cadmium sulfuricum. There was no remedy. We were free to use any remedy we were finding during the history taking, and therefore we were totally free. The interesting thing is, during this study, I was under an enormous time pressure. Despite this, the results were exciting. So what I would like to encourage is that you are just trying to use homeopathy because it may not be perfect in this situation. However, the body has obviously a lot of recreation probabilities, and therefore tends to recover by itself. This is something I have also seen with patients suffering from cerebral tumors. Actually, a colleague told me since I was treating patients additively with homeopathy, those patients lived longer. And then this was the reason actually I started with the recent study. And of course, the patient or the phosphorus patient tends to be very tired and needs a lot of sleep, and also sometimes is not really refreshed after sleep. And this might be something you should keep in mind when you consider to prescribe.
What have you learned from this study yourself as a homeopath?
I would say never give up. So I am very positive. Even if you can't heal a patient, and those patients are in a very advanced stage of their disease, I still believe the improvement of quality of life is something which is very, very important. And this also gives a relief to the patient and also improves the relationship to the partners and or family.
Did you evaluate the pain?
The pain was only rarely one of the major problems. Only in a few cases, patients reported about pain. It was mainly gastrointestinal problems and also lung problems. So patients suffered from dyspnea. And that pain, I wouldn't say that today this is a real problem.
What would be the most frequently used remedies in this study for gastrointestinal problems?
Actually, I have to admit that I'm using this additive homeopathy more in a routine way. So the first remedy I like to prescribe is Nux vomica, either C12 or LM6. And I tell the patient you should take it during chemotherapy at least once a day, but you can also enhance the dose up to 3 times a day. If Nux vomica doesn't help alone, then I prescribe Ocobaca, Aurevilly, and C12, and this patient can take it in the same way. Another remedy which might be of help is Arsenicum album, of course. And then all the other remedies might be chosen according to the symptoms of the patients. I would say in 80 to 90% with Nux vomica plus minus Ocobaca, there's no serious problem with digestion.
Do you think you would like to add something about side effects of radiotherapy?
Radiation-induced dermatitis. But today, with improved machines, this is a very rare complication. If this happens, I would use acetum fluoricum or hydrofluoricum, C12, which has been shown in a case series of Dr. Schlappach some years ago to be the major remedy helping in these cases. What I would just let you know, I encourage you just use homeopathy. It is proven, effectiveness is proven, and patients report that it's really helpful.
Thank you, Dr. Frass. It was always a pleasure to have you here, and we hope for the next episodes.
Goodbye.
Bye.